Welcome to the Great Prostate Debate. I'd like to talk with you about how certain side effects from prostate cancer treatment may impact intimacy. I am a board-certified urologist and have treated thousands of men with prostate cancer. In my experience, information and knowledge of treatment options is crucial to positive long-term results and in dealing with potential side effects of the selected treatment. The side effects from prostate cancer treatment can be scary, especially in regard to your relationship and intimacy. When men hear incontinence, impotence, erectile dysfunction, and bowel dysfunction, they may think the cure is worse than the disease, but that is simply not the case. I have had great success and seen lower incidences of incontinence and impotence from brachytherapy with Theraseed as compared to surgery. Brachytherapy treats the cancer by implanting radioactive seeds into the prostate. Now don't worry, your partner will not be exposed to radiation or become radioactive. It is a very targeted delivery of low-energy radiation to treat the area of the prostate where the cancer is growing and all areas of the prostate where cancer might originate in the future. In other words, the entire prostate gland. Let's talk about the side effects in relation to the treatment and what you can do to alleviate or at least minimize them. Urinary incontinence is the inability to hold urine inside the bladder voluntarily, commonly known as leaking urine. I have found that incontinence is a common medical condition and is treatable in the majority of cases. Since the prostate gland sits right below the bladder and encircles the urethra, when the prostate gland receives radiation therapy or brachytherapy, it can affect the bladder and increase frequency, urgency, and incontinence. This is not permanent incontinence, but rather temporary and irritative to be treated symptomatically. These are side effects of radiation energy irritation. When the prostate is removed with surgery, physical damage can occur to the muscle that holds urine in the bladder, called the urinary sphincter. There are actually two sphincters, the one controlled involuntarily at the bladder neck where the prostate begins surrounding the urethra, or urinary tube, and the urethral sphincter where the prostate ends surrounding the urethra under voluntary control. Both sphincters' jobs are to control the flow and leakage of urine by tightening around the neck of the urethra and bladder, much like the hand around a garden hose. Depending on the extent of the damage, temporary or permanent incontinence can result. The chance of immediate incontinence is around 46% with surgery, but gets better after several months to a year. The most important thing is to check your doctor's results to determine his or her specific rates of patient incontinence, not what is quoted in the medical literature. If you do experience incontinence after surgery, there are ways to treat it, including Kegel exercises to tighten the pelvic muscles, biofeedback, which is a technique using electrical instruments to reinforce the performance of Kegel exercises. There are also a handful of medications used to tighten the urethra muscles and relax the bladder muscles. Also, an operation to implant an artificial sphincter can be done, but involves another surgical procedure. This is a last resort if conservative treatment doesn't work. Until you reach urinary continence, you can control leakage by wearing a pad inside your underwear. Also, I recommend avoiding alcohol and caffeine in coffee or tea. Losing weight may also decrease the pressure on the bladder and improve bladder control. With brachytherapy and external radiation, patients may have a different reason for incontinence. In these cases, it is the bladder and urethral irritative effects from radiation therapy rather than actual physical damage to the sphincter muscles. With brachytherapy, there should be absolutely no incontinence, unless that patient has had a previous urological operation on the prostate or urethra, like a TURP or transurethral resection of the prostate for BPH. Rectal morbidity or bowel dysfunction is another potential side effect of prostate cancer treatment that affects 4 to 8% of patients. This can include diarrhea, frequent bowel movements, the inability to control bowel movements, and rectal bleeding. This side effect is very rare for patients treated with brachytherapy because the rectum is protected from receiving a significant dose of radiation in expert hands. Damage to the rectum also is rare when the prostate is removed during surgery. If you experience the symptoms following your treatment, minimize your intake of tobacco, caffeine, alcohol, and monitor your diet to avoid foods that might irritate your gastrointestinal tract. Also, talk with your family members about planning ahead while traveling so you can plan frequent bathroom stops.